So, good morning everyone. So, we will be discussing the narcolepsy. So, narcolepsy is a chronic neurological disorder that affects the brain's ability to control sleep-wake cycles. So, people with narcolepsy may feel rested after waking, but then feel very sleepy throughout much of the day. And many individuals with narcolepsy also experience an even and interrupted sleep that can involve waking up frequently during the night. Also, narcolepsy can greatly affect daily activities, and people may unwillingly to fall asleep even if they are in the middle of an activity like driving, eating, and talking. Other symptoms may include sudden muscle weakness while awake that makes person go to limp or unable to move, or cataplexy. So have vivid dream like images or hallucinations and total paralysis just before falling asleep or just after waking up. So there are two types of narcolepsy. So the type 1 is um, is diagnosed based on individuals either having a low levels of brain hormone or hypocretin, or reporting cataplexy and having excessive daytime sleepiness on a special test, or na on a special nap test. Rather, the type 2 narcolepsy is that people these are the people with condition experiencing excessive daytime sleepiness, but usually do not have muscle weakness triggered by emotions. Also, they usually have less severe symptoms and have normal levels of the brain hormone and hormone hypocretin. So, here are the signs and symptoms of excessive daytimes. I Here are the signs and symptoms of narcolepsy. So, first, excessive daytime sleepiness, EDS. So, all individuals with narcolepsy have EDS, and it is often the most obvious symptoms. So, it is characterized by persistent sleepiness, regardless how much sleep an individual gets at night. But um, um, people with narcolepsy is more likely to have sleep attack, where an overwhelming sense of sleepiness comes on quickly. In between attacks, the individuals have normal levels of alertness, particularly in doing activities that keep their attention. Next is cataplexy. Cataplexy is a sudden loss of muscle tone while person is awake, leads to weakness and loss of voluntary muscle control. So it will triggered by suddenly but strong emotions such as laughter, fear, anger, stress, and excitement. So these symptoms may appear weeks or even years after onset of EDS, but some people may only have one or two attacks in a lifetime, while others may experience many attacks a day. Next is sleep paralysis. So sleep paralysis is a temporary inability to move or speak while falling asleep or waking up. Usually lasts only few seconds or minutes, and similar to um, REM, or in those inhibitions of voluntary muscle activity. So, sleep paralysis are resemblance sa cataplexy, except it occurs at the edges of sleep. So, as with cataplexy, people remain full conscious even if severe cataplexy and sleep paralysis do not result in permanent dysfunction. So, it happens after episodes and people rapidly recover full capacity to move and speak. So next is hallucination. So um we all know that hallucination is very vivid. So we already know what is hallucination. So hallucination sometimes is very vivid and sometimes frightening imaging can be accompany sleep paralysis and usually occurs when people fall asleep or waking, and most often the the content and is primarily visual, but any other senses can be involved. So other symptoms are the fragmented sleep and insomnia. So while individuals with narcolepsy are very sleepy during the day, they usually also experience difficulties staying asleep at night, and their sleeping pattern is disrupted by insomnia, vivid dreaming, sleep apnea, and acting out while dreaming or periodic leg movement. And lastly, what do you call this? Last, the autonomic behaviors. So, individuals with narcolepsy may experience temporary sleep episodes that can be brief, lasting no more than seconds at a time, and a person falls asleep during an activity like eating or talking, and automatically automatically continues the activity for a few seconds or minutes, and without consciousness, without conscious awareness of what they are doing. And this happens most often when people are engaged in habitual activities such as typing or driving, and they cannot recall their actions and their performance is almost always impaired. So next would be medication, which being discussed by Adrian.
So next is we'll talk about the medication for narcolepsy. So first we have the modafinil. So the initial line of treatment is usually the central nervous system stimulant, such as the modafinil. Modafinil is usually prescribed first because it is less addictive and has fewer side effects than older stimulants. So for most people, these drugs are generally effective at reducing daytime drowsiness and improving alertness. So next is the amphetamine-like stimulants. So in case where modafinil is not effective, doctors may prescribe amphetamine-like stimulants such as methylphenidate to elevate EDS. So, however, this medication must be carefully monitored because this can have side effects. Excuse me. So next is antidepressants. So two classes of antidepressant drugs have proven effective in controlling cataplexy in individuals. So like tricyclics, including imipramine, disipramine, clomipramine, and protriptyline, and selective serotonin and noradrenergic reuptake inhibitors, including venlafaxine, fluoxetine, and the atomoxetine. So next is the sodium oxybate. So sodium oxybate, also known as the gamma hydroxybutyrate or the GHB, has been approved by the US FDA to treat cataplexy and excessive daytime sleepiness in individuals with narcolepsy. So due to safety concerns associated with the use of this drug, the distribution of sodium oxybate is tightly restricted. So next is the histamine 3 receptors antagonist inverse agonist. So the pitolisant was recently approved by the FDA as the only non-scheduled product for treatment treating excessive daytime sleepiness or the cataplexy in adult with narcolepsy. So pitolisant, which has been commercially available in US since 2019, is thought to increase histamine levels in the brain. So the most common it is the most common adverse reaction to pitol- pilo- pitolisants are insomnia, nausea, and anxiety. So next is we have the lifestyle changes. So the drug therapy should also be included, which also be accompanied with various life changing. So first is take short naps. So many individuals take short, regular scheduled naps at times when they tend to feel sleepiness. So next is maintain regular sleep schedule, like going to the bed and waking up at the same time every day, even on weekends, can help people sleep better. So 3 is avoid caffeine or alcohol before beds. Individuals should avoid alcohol and caffeine for several hours before bedtime. 4 is avoid smoking, especially at night. 5 is exercise daily. Exercising for 20 minutes per day or at least 4 to 5 hours before bedtime also improves sleep quality that can help people with narcolepsy avoid gaining excess weight. 6 is avoid large, heavy meals right before bedtime. So eating very close to bedtime can make it harder to sleep. So 7 is relax before bed. So relaxing activities such as warm bath before bedtime can help promote sleepiness. Also make sure to sleep space is cool and comfortable. So safety precautions, particularly when driving, are important for everyone with narcolepsy because sudden falling asleep or losing control can transform action that are ordinary and safe, such as walking along a flight of stairs, into hazards. So that would be all. Thank you.